Thank you so much for inviting me to this very interesting Congress. My regards to Dr. Egazi and to all the organizers, to Dr. Shinmaya Mapatra, Dr. Maya Sharma. I'm very glad to be with you today. So I will try to share my screen. Hope it will work. I just would like to say a few words about ISOP Israel. ISOP is the International Society of Pharmacovigilance. I'm a member of this organization since its foundation. And when I emigrated in Israel from France, I created the Israeli chapter. So what we have to do what we are doing in our chapter, which was created 7 years ago. We can go to the next slide. We wanted to increase pharmacovigilance awareness and improve drug safety and better communication through education and research. So we have these two aspects of this of our activity. Can we go next? And next. Okay, so I will start with one of the experience we have had in a small hospital, 320 beds. In fact, what we wanted to do is to try exactly what Patricia and Elena said. It's to be not only in a pharmacovigilance center, but to be really in the hospital with a healthcare professional. And I think that this is exactly what our mission in ISOP Israel is, to be a multidisciplinary platform, because we feel that the pharmacovigilance in the future must not be something that will be in the hand of the expert, like all the people who are here, but also should be a public health activity that should be done by all the healthcare professional and all the stakeholders, meaning the patients, the industry, the healthcare professional, the hospital, the community. So we have the first aspect was to set up a multidisciplinary team. I think that we are missing some. Okay. So the idea of this project was to start with a multidisciplinary team to be sure that all the healthcare professional will really follow the project and will adopt it when it will be in their department. So we had a core team which was dealing with the project, and we had a few experts that when we had some few questions, very specific questions, we were going to the expert of Department of Neurology or Hematology or Laboratory. So then we had people from, which was again, next. We had people from the emergency room, nurses, the risk management, and also the management of the hospital. And we have people experts from all kind of departments, with also intensive care and pharmacy and the hospital medical director. So we were sure that all these people will be able to adopt what we will do during this project. Next. So our project is threefold. The first of the three parts is the drug safety practices. For that, we have used the ISMP self-assessment. The ISMP self-assessment is a Institute for Safe Medication Practices. We are partnered with the ISMP, and we have chosen to focus on the anticoagulants, because we thought that on this way, we will be able to have a consensus again in all the healthcare professionals, that everyone agree that it's a high alert medication. So we have adopted this focus on anticoagulants. And then we have set up the multidisciplinary, and we went to the ISMP self-assessment. So this self-assessment is like a very long questionnaire, about 120 questions, going through all the process of medication, prescription, training of the patient, training of the healthcare professional, point of care, laboratory, everything, communication and packaging, everything. So it's why we need to have this team going to each department and to check all these criteria. And then it will give you like a score about where you are. And this score is very, very specific, because it tells you exactly where are your strengths and where are your very weak points. Then you are able, it's like an audit, you are able to make like a diagnosis of where you are, and you can do like a FMEA to say what are the gaps, what is the most urgent to address, and what is the most dangerous. And then you can set up a CAPA implementation, corrective action plan. And then if you run again the ISMP self-assessment, you will have a really performance indicator, because you have a new score and you know exactly where you have improved or where you have not improved. So in fact, we were combining this ISMP self-assessment with the pharmacovigilance approach of risk management, and to bring some solutions. So perhaps we can go next. So the result after about 6 to 7 months of an analysis and CAPA and implementation. So the first result was the following. So you see that you have in each of these columns, you have 10 to 20 questions, and you see that we are really going through all the aspects of the drug, of the medication process. And we can see here that we are very poor on drug information, and this is where we have to work, or in medication, medication devices, also patient education. So we see all the weaknesses. Next. So even if it's in Hebrew, I think that the most important is the color, because we have been able to identify what are the most urgent gaps that we have to address. And according to the color, we were able to set up our CAPA and to have some deadlines. Can you go next? So, for instance, we have seen that we had the 5 more important actions that we have to take were in these 5 fields. The protocols, there were not enough protocols written for each department with its own specificity. The training of healthcare professionals about the new drugs or even the old ones. The patient education, and especially the communication between the hospital and the community. The IT system modification to receive adverse reaction, and the medication reconciliation with when a patient enter into is admitted in the hospital, or when he's going out, to be sure that we are doing the medication reconciliation. Can we go next? So here you can see the difference between before and after the CAPA, after having taken some actions. And you see, for instance, in the competency and staff education, that with our actions, we have been able to improve each almost twice the quality of this staff education. And then about the medical device, we have found that some medical devices were not used or not correctly monitored. So then we had a very good result compared to what we have done. So, of course, we have all the details of this CAPA, but I just wanted to show this idea. The second aspect, next. The second part of our project was the adverse event reporting and analysis. For that, we had two ways to do that. We had inside of the hospital IT system, the healthcare professional had to report the adverse reaction. But we thought that we had also to invite the patients or the healthcare professional outside of the hospital to report their adverse event. And for that, we have worked with a company named Drug, which has sponsored us completely. And they have developed My E-Report. My E-Report is an application on mobile and on PC, also on computer. And you can report very quickly and easily your adverse event in a very in few minutes. So we have designed a poster and a flyer for the patients. We had a safety database, which is also provided by Drug, and we were supposed to train the staff in the hospital and to manage the adverse drug reaction, which was just before the COVID, so we were stuck. But we have new plans to use what is ready, and I will show you after that. Next. Okay, so you see here, you have the way My E-Report is organized. It's the E2B field. Next, please. And it's completely free. You can download it from internet. No, previous slide, please. And we have translated that into Hebrew, and it's already available in other languages, and it can be used by patients and healthcare professionals. Next. So when you are reporting in My E-Report in Israel, but it's the same also in France or in other countries in Europe, the adverse reaction is going directly to the Israel Ministry of Health. And also in parallel and automatically, it's going to our safety database. And it's going to the E2B safety database in HTML E2B, meaning that they are entering the right fields. It's not a PDF. It's not a free text. It's really much more useful, and we can analyze our adverse reaction. Next one. Okay, so I just wanted to show you the flyer that we have designed, and we have thought that perhaps we can explain to the patient that it's exactly like Waze. If you are in a traffic jam and you are reporting, you are helping the full community. So this is also the message that you want to send to the patient. If you are reporting your adverse event, you are helping the community. And you see that, I see that Dr. Chinmaya Mahapatra has already put some small video about reporting, because we are now in a time where we have to be very good communication skills. And so what we are trying to explain to the patient, if you have a drug or if you have vaccinated and you have an adverse event, you go to your doctor immediately, and you report also to my e-report, and then it goes to Ministry of Health and to ISOP Israel, and then it's better for everybody, because thanks to you, we have a better understanding of the safety of the vaccine or the patient or the drug. So now we have our next project is to use that for the pregnant woman, because now we are vaccinating pregnant women, and I'm setting up a group of young pregnant women with a pharmacist to make like a registry, meaning that even if they have no adverse event, they will be in our registry, and then we will be able to follow up. So this is something that we will start next week, because everything is ready. So this is something which is completely available, and I think that I will be very glad to have more people, more countries participating to this project, because we really need to have more information about vaccination and pregnant women. We have a lot of questions, so I think that it should be something that could be international. So I invite you to join this project. Another next. So I just wanted to tell you a few words about another partner that we have, NIDIMED's BMedWise, that is focused. It's a US organization focused on patient education, and they have a lot of tools, video checklist, pocket guide that are explaining to the patient that they have to check some question with their healthcare professional, with the pharmacist, with the doctor, and it's really very interesting, and I'm very glad to share this information. Next one. So right now, just to come back to our more education part in ISOP Israel. Since December, we have been invited to present the vaccine, to explain what is this vaccine. And I've been invited at least 5-6 times in 1 month in different institutions, in schools, in healthcare professional communities. And then suddenly we received a lot of questions. And I understood that certainly people are not, it's difficult to find the question at your answer to your question when you are when you're in the regulatory or in pharmacovigilance. You know how to go to the regulatory authority website, or you go to literature. If you are a physician, you go to the literature, but regulatory authority is quite difficult. Then if you are a general public, to Facebook, and then you have a lot of fake news. So we have tried, we understood that people are really lost, and so we have set up a task force on vaccine. We are not about 50 people, physicians, pharmacists, biologists, molecular biologists. We have also a translator. We have somebody helping us on the website, and so we have set up question and answers in net, in English, in French, and in Hebrew. So this is our website, and you can see here our question and answer. You are very welcome to come and to see what we have done. We are also writing very strong articles, and it's all of what previous. Yes. All what we are doing is peer-reviewed and validated on regulatory information and vaccine safety net. Also, we are in contact with vaccine safety net. So just a few words about our online program. We are very active since this summer. We are organizing every month two events about preventing case safety. And now we are coordinating with the Latin America chapter weekly webinars on vaccine vigilance. And it has started yesterday, and you have next one. All the February events are free. It's a very high level and very high level expert speaking. And we have a collaboration with a lot of people. Now, just a few words about the strengths in Israel. It's the fact that we have a top digital health system with 95% of the data are in the medical record, electronic medical record. We have a committee and an advisory board with people from the previous FDA, the president of WHO UMC Monitoring Center. We have a lot of partnership. We hope that we will strengthen our partnership with PV, with your organization. And thank you very much for inviting me. And I think that what we do is to try hard and hard and hard. And this is the only way to be efficient. Thank you so much.